Hi there, I want to share with you a very crucial condition called G6PD deficiency in persons, and as compared to the other genetic blood disorders, it is not so popular but very important that we create awareness of this condition. Glucose phosphate dehydrogenase deficiency is a genetic condition that can be passed down from parent to children and mostly affects the males. It happens when the blood or the body doesn't make enough of this enzyme called glucose phosphate dehydrogenase, and it is present in the kidneys and the liver and helps the red blood cells work properly. It also protects them from substances in the blood that could harm them. In people with G6PD deficiency, either the red blood cells do not make enough of this enzyme or what they make doesn't work as it should, and without enough G6PD to protect them, the red blood cells breaks down. It is a type of haemolytic anemia, meaning the oxygen carrying red blood cells break down too fast, called hemolysis, leading to a lack of red blood cells, and that is very dangerous because the cells, the tissues and the organs are deprived of oxygen and nutrient, and they can cause cell tissue death in any area of the body. Important enzyme or protein also regulate various biochemical reactions in the body. So who are those at risk of G6PD deficiency? Number one, males or African Middle East descendants and then a family history of this condition. And most individuals are asymptomatic. However, this hemolysis can make you severely anemic, which sometimes can occur very quickly, and you may get extreme dizziness, paleness, sudden increase in blood temperature, fast heartbeat, an enlarged spleen, jaundice, that is yellow discoloration of the skin or mucous membrane, a dark yellowish urine, shortness of breath, and worsening of any physical condition. And in extreme cases, it can lead to death, especially if you have some chronic health condition. How do we diagnose this condition? It is very simple. It is done simply by doing a blood test to check for the G6PD enzyme levels, and other tests that can also be done in addition may include a complete blood count, serum hemoglobin test, and then reticulocyte count. You see, most people with G6PD deficiency don't have problems most of the time, but there are certain medications, foods, and substances that can increase the rate of the red blood cell breakdown and trigger anemia, and that can be very dangerous. So we're going to look at the do's and don'ts of persons with G6PD deficiency, especially the triggers of these symptoms of this condition that we need to avoid. Now, the first triggers under foods include fava beans, also known as broad beans, then bitter melon, aniline dyes such as the henna, we have the soy, the peanuts, the peas, the fenugreek, and other legumes have also been noted to produce these symptoms of person with G6PD deficiency. So you must avoid these foods. Number two are the drug, and mostly the sulfa antibiotics that are typically used to treat skin and urinary tract infections. We have the quinoline antibiotics such as the ciprofloxacin, the levofloxacin, we used to treat urinary tract infection and the pneumonia. Then we have the nitrofurantoin used to treat UTIs, and then any anti-malaria medications such as the Aralin, that is those that contain the chloroquine, and then the use of the naphthalene bulbs, and then high doses of aspirin can also be a trigger for people with G6PD deficiency. And then any quinidine drugs such as the amitriptyline, and then all the other sulfa drugs such as the dapsone, the Lasix, that is the furosemide used in diabetics, the solamide, the Bactrim, and the sulfanilamide. So it is very important that if you have G6PD deficiency, you read every drug label given to you to avoid the triggers and the dangerous effects. Since we're talking about genetic blood disorder, if you don't know what this other genetic blood disorder, I think you should check it out right now. Hey, always remember that God wants you healthy. Your health, your life.